Hello everyone, this is Dr. Yaşar Başağa talking. I'm Doctor of Urology and Andrology, and we have an andrology clinic based in Istanbul. Today's topic is surgical treatment of premature ejaculation, which is selective dorsal neurectomy. Now, today I would like to talk about long-term results of selective dorsal neurectomy surgery, because you know that selective dorsal neurectomy surgery is very popular in southern countries, Korea and other Asian countries, and in Europe there are limited centers that perform selective dorsal neurectomy surgery. We are one of the highest volume centers which performs selective dorsal neurectomy surgery. Now, at last 3 years we did many selective dorsal neurectomy surgery, and I would like to talk about a little bit long-term results of selective dorsal neurectomy. First of all, when we're starting, I would like to talk briefly about selective dorsal neurectomy surgery. What is selective dorsal neurectomy? Selective dorsal neurectomy is one of the best solutions for primary premature ejaculation, which is a surgical treatment and can be done under local anesthesia or general anesthesia. If you are getting afraid of pain during procedure, we can do it under general anesthesia, but local anesthesia is generally enough for procedure. This is done under around 45 minutes of surgical treatment, and we can complete whole procedure, and you can go to your social life immediately. After procedure, you have to interrupt your sexual life for 1 month, and after 1 month you can go through your sexual life. How is neurectomy performed? It is done with the circumcision, coronal incision, but if you don't want to get circumcision, we can use another incision technique and we can complete our surgery. Who can get selective dorsal neurectomy surgery? There is 3 important rules to get selective dorsal neurectomy surgery. If you have to have primary premature ejaculation, you have to have hypersensitivity. How can we understand you have hypersensitivity or not? There are 2 techniques to understand hypersensitivity. The first one, if you are getting benefit from local anesthetic creams or sprays, yes, you have hypersensitivity, or we can measure with a special device which is called sensiometer, and we can understand if you are hypersensitivity or not. The third thing, you have to try other treatment modalities before surgical treatment of premature ejaculation. If you have these 3 rules, you are indicated to get surgical treatment for primary premature ejaculation. The most important concern about surgery of our patients are generally, the first one is the erectile dysfunction, the second one is the loss of sensation, because patients think that if we cut all of nerves, they will lose their sensation and erection. Let's start with the erectile dysfunction. You have to know that, I have to remind you that the erectile nerves and the sensory nerves of penis are completely different from each other. We know that the erectile nerves go into the penis at the root of the penis, and the sensory nerves are carried on dorsal part, the part that face with us, and these are superficial nerves and they are completely different from the erectile nerves. Cavernous nerve brings erectile stimuli to penis, and pudendal nerve carries sensory stimuli to our brain, which carries touching sensation, heat sensation, and which has also important role in sensation of ejaculation, control of ejaculation. We want to try to slow down the sensory nerves, and they are completely different from the erectile nerves, so there is no risk to get erectile dysfunction after cutting the sensory nerves. The only scenario to get possibly erectile dysfunction is cutting all nerves, which is if you do non-selective neurectomy, patient does not feel anything, just like he's using creams, and he will not feel anything and he will get erectile dysfunction. But if you are not cutting all of them, there is no risk to get erectile dysfunction. The second thing which patients are afraid, the loss of sensation. We are doing 360 mapping of sensory nerves of the penis. After 360 mapping of nerves, we are cutting around 80% of nerves, but we cannot give any ratio for unique patient, because we decide in unique patient how to cut, because I want to preserve whole 360 sensation of the penis, and cutting, I'm preserving one nerve which gives branch to all parts of penis on the right side and one in the left side, and then cutting all other of them, because we want to try to preserve 360 sensation of the penis, and we try to slow down just hypersensitive nerves of the penis, and we can use some electrodes and some electromagnetic studies to detect what's going on with the penis, and we can decide for unique patients, and we prevent loss of sensation after surgeries. Now we are over 1,000 cases of selective dorsal neurectomy, and we will publish the first 100 cases in this year, and for those 1,000 of patients, I've never seen complete loss of sensation, and I've never seen erectile dysfunction after surgery. It's really very important to have a strong technique, and it's really very important to do a precise surgery for the selective dorsal neurectomy. If you are using right technique, as in our case, there is no risk to get erectile dysfunction and months of sensation. The satisfaction rates after surgery is really very high. Around 95% of our patients are getting success. What's the success after surgery? Generally, the most important success story after the surgery is getting control of the erection. Patients can ejaculate whenever he wants, but in some patients we cannot give control of ejaculation, but they are getting at least 5 minutes of latency time in vagina if they are less than 1 minute before surgical procedure. If you are thinking of getting premature ejaculation surgery, we have a high center and we are one of the pioneer clinics in Europe for the surgical treatment of premature ejaculation. You can contact me and my team via this channel and can learn much more about treatment options.